welcome everyone to our January 25th clearinghouse meeting. And we will await other participants. But as you know, this is a meeting focusing on combating women's health and wealth inequities. And let me just, before we start the program, let me make one announcement, which is about an ERA gathering at the White House at noon on Thursday. This is the 27th, in support of the ratification of the ERA, which I know a lot of people on this call have been involved with. And as supporters of the ERA know, this amendment met the 38 state requirement when Virginia was the 38th state to approve it 2 years ago. And the amendment says it will take effect in 2 years, but a holdup is now that the Justice Department's Office of Legal Counsel followed a Trump intervention not to publish the amendment. So proponents are asking that the directive be withdrawn under that directive for non-publication be withdrawn so that the archivist would publish the amendment to the Constitution. Okay, now we're going to pivot to our program. As you know, we have two stellar speakers today to discuss women's health and wealth equity. Martha Burk, who started the National Coalition on Women's Organizations, of which the Clearinghouse was a member, and who wrote many books on the subject of women inequality, will start off our program, followed by Alanna Murrell, Special Projects Manager of the Black Women's Health Imperative. So too has she led the conversations on the subject of culture and consciousness, women's health. I invite you to Google either of them to see much more than we can tell you about them, but interesting to learn about them. I started to show books and things, and you can find them on your own, but I will ask you to put your questions in the chat feature at the bottom of the screen, and I'll post the questions from the chat. So we are ready to go, and as people join us too. So Martha, please start. Take it away.
Thank you very much, and thank you for the opportunity. I see the name of many old friends and colleagues that are tuned in, and I much appreciate it. I appreciate CWI for sponsoring this session, which I think is very important because women are suffering not only in health and wealth, but many other ways because of COVID. And I want to start just with going over a few of the numbers of what has happened to women in terms of employment during COVID, because we're all being affected up and down the row, but women of lower income and in service jobs, which have become more and more important during COVID, health aides, nurses, all kinds of support systems that are primarily held up by women have been affected. And women who have no education beyond high school have suffered the most. And these are the women who are in these service jobs and need the money the most. But some of the jobs have dried up. Many of the supports for women who are in these jobs have dried up because either of funding or childcare has closed, which we'll talk about that a little bit later. But women at the lower end of the income structure have lost many, many more jobs than men similarly situated. Just take the women with a high school degree. Twice as many women with high school diplomas have lost their jobs during COVID as men with high school diplomas. Some of that is because women have been traditionally and are still confined to indoor work, childcare again, one of them, home health aides, cafeteria workers, that sort of thing. Men often have jobs that are outside, construction and so forth. And so COVID has not affected that sector of the male workforce as much as it has women. Women have lost income. They have had to go on public support in much higher numbers than men have during COVID. We all know and hope that with the Omicron is slowing down, we are seeing more fast food and that sort of thing opening back up again, female dominated jobs. Again, even though wages have gone up and hamburgers have gone up, people are complaining your Big Mac costs 25 cents more. That is helping to keep women in the workforce, and it's a little bit of help for women that are on these low wage jobs. Now, what we have to keep in mind though, is when they say the hamburger goes up a quarter, what we don't know is how much of that quarter goes into women's pockets or men who are working there, or how much of it goes to the bottom line to the stockholders. So if anybody tells you, well, women's wages are going to go up because hamburgers are going up, gasoline is going up, etc., don't believe it 100%. Yeah, they might have to raise the wages by, I don't know, 10, 15 cents an hour, maybe even as much as $1, depending on where it is. But a lot of that money is still going to the very rich stockholders and the owners of the company. And a little bit later, I'll talk about the gazillionaires who have paid no taxes in the last few years, and women at the bottom, middle, and even high income are mostly in salaried and wage jobs, and they do pay taxes. So we need to keep that in mind. So we had, I was asked to, I just wanted to open with that because to show us where we are in terms of women's employment overall. We've lost more than men during COVID. But I want to move now to pay equity, which is the main thing that I do. I try to help entities such as state governments, some large corporations, nonprofits, to analyze and do something about pay gaps if they have them in their workforce. And we do have quite a few pay equity initiatives in the United States. We have had the Equal Pay Act. How many of us know that? Most everybody on this call knows the Equal Pay Act passed in 1963. And the Title VII of the Civil Rights Act passed in 1964. Both of those are our main laws prohibiting discrimination in pay. Where are we now? We're still 20 cents on the dollar behind similarly situated men. Why hasn't this worked? Well, there's one phrase that explains it. Almost all of our laws, I would say 99.9% of our laws, and we'll go through some at the city and state levels, are what we call complaint driven. So that means, take the Equal Pay Act. The companies are prohibited from paying women less than men for the same jobs, and courts have historically interpreted that as the same job. So you can't compare, for example, dog pound attendants to cafeteria workers, even though the skills, et cetera, might be fairly similar in the education. It has to be the same job. So that's a problem. But the biggest problem is that all of the laws are what we call complaint driven. And that means that the woman, think of this, she's on minimum wage, she's working 50, 60 hours a week, in some cases 80. She does not have the resources to hire a lawyer. Complaint driven means she's got to do that though, and then go to court and try to prove that the employer has done something wrong. There is no what we call affirmative obligation for the employer. It's just goodwill. If they feel like it, they can do it. But there's no law that says you have to do this affirmatively. It just says you're prohibited from discrimination. And there's a big difference there. I think we can all recognize. We have had some laws in various states. I'll talk about the one here in New Mexico, which is where I live now. because I think it's a good example of what can be done. For a start, it's also a good example of what happens politically when we get into the very touchy subject of pay equity. So when I moved out of Washington and left the National Council of Women's Organizations, I came to New Mexico, and the governor, who was a guy named Bill Richardson, some of you may have heard of him, he's former UN ambassador, asked me if I would become his senior advisor for women's issues. And I said, yes, I'd love to. We can do something no state has ever done. So we crafted not a bill, but a system which the governor put in by executive order, very important, because it's hard to get a bill passed. As we all know, it can take up to 20 years to get a bill passed. But we did an executive order requiring employers, if they have a state contract, to tell us how they pay women and how they pay men. They have to tell us in every job category, how many women you have, how many men, what are the women making, what are the men making, and we use the EEOC categories, so there's no confusion about that. Everybody's on the same page. And what we found is a 20% pay gap in the state. So the idea is maybe you could shame the employer into, it's public information, anybody can look it up, shame them into making some change. But also, if they don't, after a certain length of time, they're going to lose their state contract. That can be millions and millions of dollars. So that's all the good news. It went well. We got it in place. The reporting was in place, all online. Any employee could look it up. Anybody looking to do business with one of these contractors could look it up. So then, guess what happened? An election. And the election, the governor was termed out. He couldn't run again. I'm sorry to say, a woman of the opposition party ran for governor and she won. What did she do? She did away with the pay equity initiative altogether. And what that means is she just quit enforcing it. She told state personnel, don't bother with that. We don't care about it. We're not going to do that anymore. So that's the signal to the contractors. We don't care. We don't have to do anything about pay equity. That's where the politics comes in. And unfortunately, we now have yet another governor. This is the third one. This is a woman, Michelle Lujan Grisham. Perhaps you've heard her name. She knows about the pay equity initiative. It's still there. It's still in the books. She has done nothing. So we have to keep in mind that many politicians are not driven by goodwill, so to speak. They're driven by personal ambition. And if it's no longer their initiative, they don't care about it. So that's just a word of caution. One of the things, though, some good news in terms of pay equity that has come along recently, and it is gaining momentum, is this idea of you can't ask a prospective employee if they're interviewing, well, what did you make on your last job? Because what happens there? We know women make less than men on almost all jobs and in almost all companies except the federal government. So you started out, let's say you were making $30,000 a year and the men were making 35. So the employer perspective asks each one of you separately, of course, what were you making? The guy says 35, the woman says 30. So the employer then says, oh, lady, we'll pay you 31. And they say to the man, we'll pay you 36. So what happens? That pay gap stays with you all of your career, as long as the employer can ask you in the interview, what did you make at your last job? So we've had some good changes in that way. A lot of places, including New York City and the state of New York, have prohibited asking salary increase, prior salary before they hire someone. So they have to pretty much try to hire on the basis of what the person is going to be worth to the company, or at least that's what we hope. And that they don't automatically assume that the men are going to be more valuable than the women, because we know that's not the case. I won't go into all the pay equity initiatives because I don't want to run over my time, and I got a couple other things. But if you look at my website, and it's marthaburk.org, and also there is, I have a separate website that is genderpayequity.org. It lists all of the states, cities, and counties that have pay equity initiatives and how good they are or not so good. For example, Boston has one where the company can join this collective that promises to do better on women's pay versus men's, and they get a lot of good publicity out of the city of Boston. Guess what? In several years, it has not moved the needle one bit in terms of helping women make more money. What it does is help the companies look better to the public. So that's something we have to be aware of. I do want to move, though, to some other things when we get to women's health and wealth. And there is, and Alanna will talk a lot about this, I think, there is a very clear intersection between wealth and health, because women in lower incomes don't have the ability to access the health system, even with Medicaid, in the same way that women with private insurance have. So that's part of the health and wealth. Many times low income women can't take off work. They don't have a lot of vacation or sick leave even. And so I know, again, Alanna will talk about that, but I just wanted to mention it because it is an extremely important part of the pay equity problem. Now I want to move to what can we do? And one of the things that we really could do to help women and help close that pay gap in this country, and it's not going well right now, but is to pass Biden's Build Back Better plan, because in it, there are so many things that are going to help women and women's wages. What happened during COVID? Yeah, women lost jobs. One of the big reasons, no childcare. So Build Back Better has a lot of money for early childhood and childcare. We are the only industrialized country on earth, I'm checking my time here, that does not have subsidized childcare. So we need that. It's in Build Back Better. Costs a lot of money. We're hearing about Kristen Sinema and Joe Manchin are saying it costs too much money, we can't do it. Guess what? We spend 10 or 15 or 20 times as more every year on the defense budget, or the so-called war budget, as I call it, as we do on Build Back Better over 10 years. So there's a huge disparity in our national priorities, and that really counts. Another very important thing in Build Back Better is the ability of home care workers to increase their wages by joining a union. And that is not something that is talked about very often when we see people talking about it on television. But it is important, as we all know, and many women on this call know, unionized women are much closer in pay than many other workers, because unions do protect them and they are paid equally with men in the same jobs by and large. So that is something that's really important. I just throw out one more little statistic about how we spend our national priorities. Does anybody know, and just raise your hand in your mind, how many warships the United States has? Because we're talking about going to war now in Belarus and against Putin and so forth. Guess how many warships we have? We have over 400. And in the next military budget, there are 40 or 50 that are on the drawing board. So again, it's national priorities. Women are the backbone of the workforce, especially in support systems. So we must do something about the gap. One last little thing, because most of us are not in this category, but let's talk about millionaires and gazillionaires. Women still do not have the access to the venture capital money that men do, not near. So a guy comes in, he's got a pitch for some new company that's going to make him a Jeff Bezos or a Warren Buffett, neither of whom paid any taxes last year. And the guys all pitch in and say, oh yeah, I'll take a piece of that. I'll go with venture capital. They don't do the same for women. So it's much harder for women, even at that top level, to make more money. I know my time is probably out, so I will cede the floor to the next speaker and we can continue with questions.
Thank you so much for the clear presentation and also for asking your own question about what we do. And we will get back to you and with more questions, and we will go to Alanna for her presentation. And thank you very much. Yes, thank you.
Okay, perfect. So good afternoon. My name is Alanna Murrell. I'm the Special Projects Manager of Black Women's Health Imperative, and I am really excited for today's much needed discussion. This afternoon, I will be highlighting the foundation of health disparities and the social determinants of health that heavily contribute to where we are today. For those who aren't familiar, I'll be giving a brief background on Black Women's Health Imperative and centering a few of the key issues we focus on, which are maternal health, climate change, the impacts of climate change on maternal health, obesity, cardiovascular disease, and breast cancer. I'll also be sharing a few policies advocating for health equity, a few of Black Women's Health Imperative's main initiatives and campaigns, and a very simple call to action that everyone here can participate in. So with that being said, let's dive into Black Women's Health Imperative and what we stand for as an organization. So Black Women's Health Imperative is a national nonprofit dedicated to advancing health equity and social justice for Black women and girls through policy, advocacy, education, research, and leadership development. We identify the most pressing health issues that affect the nation's 22 million Black women and girls and invest in the best of the best strategies and organizations to accomplish our goals. So feel free to visit our website. It's www.bwhi.org for more information on everything covered in this presentation this afternoon. And get ready, because there is definitely a lot to cover. The history of health inequity is extensive, and it's not unusual for Black people, specifically Black women, to be neglected, mistreated, and or completely ignored within the healthcare system. We cannot have a conversation about health inequity without discussing racism. Black women are facing threats from all angles at all times, especially in healthcare. And Black women usually don't have the best health coverage and face various health issues with healthcare access. Even still, many Black women with healthcare access have to deal with longstanding implicit biases in hospitals and doctors' offices. Many Black women are ignored when they complain about pain or concerns around their health, which then leads to a later diagnosis and possibly an earlier death. And I'm not sure if you're aware, but there is a myth going around stating that Black women have a higher pain tolerance. And I'm here to tell you that this statement is far from true. And because of myths like this, Black women and their health concerns aren't taken seriously. So this is where gender discrimination comes in. It's a known fact that women aren't treated with the same respect as men. Martha briefly went over that, but we also know that Black people are valued far less than their white counterparts. So living as a Black woman, you're faced with the prejudices that come with both, and it's twofold. So being heavily discriminated against is a challenge in itself, and the systemic inequities involved in our nation's social determinants of health only add to the problem. So we briefly covered the social and our community context, which encompasses racism, discrimination, and violence in social and medical settings. Financial equity plays a huge part in gaining access to healthcare, but let's be clear, You don't have to be poor or without quality health insurance to suffer the consequences of a racial and culturally uninformed system. For example, Beyonce Knowles, we all know her, a billionaire, and Serena Williams, we all know her, a millionaire, both endured life-threatening issues during their pregnancy and in their delivery processes. And this is just one example. According to the NIH, African Americans are among the top populations who are most at risk for health disparities. Regarding healthcare access and quality, communities of color and low-income communities face limited access to quality healthcare and have higher rates of underinsurance or no insurance coverage, resulting in lower general health status. Black women are disproportionately subject to disparities in reproductive and maternal health outcomes, cancer deaths, and chronic disease diagnoses and outcomes, largely due to gaps in access to quality and innovative care. Access to quality, affordable care will allow healthcare providers to detect and treat health issues more effectively in Black women, which can potentially lead to a reduction and hopefully elimination of health disparities impacting Black women. Economic stability is key. Without economic stability, populations are faced with lower wage jobs and higher incarceration rates. And according to the American Psychology Association, research has shown that race and ethnicity often determines a person's socioeconomic status. And Black Americans face gaps in representation, wages, business ownership, and more. So we're going to move on to education. Access to education and quality of education is crucial when it comes to determining one's future across the board. And without proper education, people have lower rates of health literacy and potentially face issues finding higher paying jobs. So I'm not sure if you knew, but Black women comprise of 65% of the student population at HBCUs earning bachelor's and master's degrees. So these women usually go on to earn advanced degrees and they become doctors and researchers and contribute their expertise and lived experience to the healthcare field. It's imperative that our people not only have equal access to a great education, but that we land jobs allowing us to serve and protect our people from the top and increase representation in fields where it matters most. And last, but certainly not least, the neighborhood you live in and the surrounding environment. Your location can heavily contribute to the rates of food insecurity you may experience due to food apartheid, less access to safe and affordable housing for you and your family, reliable transportation to get from A to B, and locations to engage in physical activity. Climate change, which we've all heard a lot about recently because it's real, goes hand in hand with this as well. So I'm sure you're all familiar with air pollution, water pollution, issues with water access, and even heat islands to some extent. However, these climate issues disproportionately affect communities of color, and African Americans contribute 23% less to climate change, but bear 21% more of the harms when compared to other racial groups. So if these aren't clear examples of inequity, I'm not sure what else to say, but every single one of those social determinants I've mentioned heavily contribute to the health inequities communities of color face. Black women have navigated danger in America for centuries. Our humanity, our safety, our rights are devalued in the workplace, doctors' offices, classrooms, our own neighborhoods. So the big question, I think, is what can we do? And the first step towards a brighter tomorrow is to educate yourself. Getting familiar with the disparities Black women and their families face on a daily basis is key to promote change and equality. So last year, Black Women's Health Imperative created a national health policy agenda. The health crisis faced by Black women and girls has spiraled for sure. So policymakers, healthcare providers, community-based organizations must pay close attention to the adverse effects of disparate funding, underrepresented research, unhealthy conditions, social attitudes about the well-being of Black women, so on and so forth. So the Black Women's Health Imperative National Health Policy Agenda is a foundational policy blueprint. It offers evidence to both policymakers and practitioners as to why the health and wellness of more than 21 million Black women matters in the United States. So the agenda is divided into 5 pillars. You have access to quality and affordable healthcare in areas of high priority for Black women's health. Here you will find more information on what is covered in this presentation. And then there's also equitable responses to public health emergencies, sufficient diversity in clinical trials and healthcare delivery systems, funding for historic Black colleges and universities, and social justice. So you can access our policy agenda on our website, and I will also post a link in the chat after the presentation for those who want to take a look. Black women are usually the backbone of their family, and most of us consider our mothers the rock of our familial foundation. So that's why it's so important that we discuss the inequities Black women face when it comes to maternal health. Without a successful pregnancy and birthing process, none of us would be here today. So Black maternal and infant health is in crisis. Black women are 3 to 4 times more likely to die from complications of pregnancy or childbirth than white women. And there are also devastating racial disparities in infant mortality for Black women. And according to maternal health research studies, Black infants in America are now more than twice as likely to die as white infants, a racial disparity that is actually wider now than it was in 1850, which was 15 years before the end of slavery. So this racial disparity persists regardless of age, socioeconomic status, education, and other factors. And a Black woman with an advanced degree is more likely to lose her infant than a white woman with less than 8th grade education. According to the Centers for Disease Control and Prevention, CDC, more than 60% of pregnancy-related deaths in America are preventable. So Black women are also twice as likely to lose their babies to premature death. Causes include insurance coverage gaps and social determinants of health. The prevailing reason is linked to racism and implicit bias in medicine. And Black women are also disproportionately impacted by risk factors related to pregnancy, such as hypertension or gestational diabetes. And these factors are made worse by the compounded stress of racial discrimination, lower quality healthcare, and climate change as well. So as you can see, there's definitely a clear pattern. We've covered climate change a little bit, but let's dive a little deeper into the impact of climate change on maternal health. So African-American mothers and babies are harmed at a much higher rate than the population at large. And as you can see on this slide, temperatures across the US are increasing. Heat kills more people than all other weather-related deaths combined. Pregnant people are more vulnerable to heat illnesses than other healthy non-pregnant people. And studies show a link between exposure to high temperatures and adverse health outcomes in preterm birth and low birth weight, which can result in developmental delays and are risk factors for infant morbidity and mortality and stillbirth. Exposure to increased heat can also increase the lifelong risk of cardiac disease, respiratory disease, and infectious disease. It's evident that climate change harms those with least resources. And as you can see, the most vulnerable populations have to deal with racism and microclimates. So people are becoming more aware of maternal health disparities and how climate change heavily impacts the quality of life for Black moms and babies. So I don't know if you've heard of it, I'm sure everyone here has, but the Protecting Moms and Babies Act from climate change, the Protecting Moms and Babies from Climate Change Act, is a bill that was created last year in February under the Black Maternal Health Omnibus Act of 2021 to establish a grant program to protect vulnerable mothers and babies from climate change risks, and addresses racial and ethnic disparities in adverse maternal and infant health outcomes, adverse environmental impacts, and disproportionate adverse impacts on racial and ethnic minority groups and other underserved population. So although the statistics I've shared are extremely unfortunate and make it easy to feel like all hope is lost in these areas, just remember that there are bills like the Protecting Moms and Babies from Climate Change Act that are out there being put before Congress that people and organizations are trying to support. I think it's important to remember that the situations that we discussed today are not final. We have the power to change the outcomes for women and children of color, and we have the choice to support those who are constantly doing the work to ensure better maternal health outcomes for those who can't speak for themselves. So there will be more on policy advocacy in a bit, but I'd like to just move on to unequal burdens of obesity. So obesity has become a serious health crisis in the United States, with 42% of Americans being obese. However, Black women have the highest rates of obesity or being overweight nationwide. So about 4 out of 5 American women are overweight or obese, according to the US Department of Health and Human Services. Poverty and discrimination contribute to higher obesity rates in Black people. So for example, Black adults have the highest level of obesity nationally at 49.6%, which is largely driven by the adult obesity rate among Black women, which is 56.9%. So obesity can lead to hypertension and various forms of cardiovascular disease. So those who are overweight and obese are more likely to have high blood pressure and high cholesterol. And obesity with these conditions serves as a precursor to poor health outcomes related to cardiovascular disease, which is the chronic illness we will be discussing next. Heart disease is the #1 killer of Black women, according to the American Heart Association. Among Black women ages 20 and older, nearly half, so 48.3%, already have cardiovascular disease. And this disease kills nearly 50,000 Black women annually, but only 1 in 5 Black women believe she is personally at risk. So major risk factors for heart disease include diabetes, smoking, elevated blood pressures, high blood cholesterol, physical inactivity, obesity, and a family history of heart disease, factors that all disproportionately impact Black women. Research also shows that prolonged exposure to stress, as from coping with perceived racism, may produce higher cortisol reactivity. So in Black women, cortisol, a stress hormone, can lead to higher rates of obesity, which increases the risk of heart disease and other chronic illnesses. Efforts to improve the heart health of Black women should be top policy priority. Black women specifically are 60% more likely to have high blood pressure and 20% more likely to die from heart-related complications. And increased access to preventive care and affordable cardiovascular medicines and medical devices, it's crucial. Since Black women So yes, we're moving on to breast cancer. Overall rates of breast cancer in Black and white women are about the same, but Black women are 20% to 40% more likely to die from the disease. So since Black women have the highest breast cancer mortality rate of any group in the US, and younger women are more likely to present with triple negative subtype of the disease, which is a more aggressive and associated with a higher mortality, it is crucial that Black women have access to healthcare and are able to make appointments for annual mammograms. Early detection is key to survival, and when it comes to breast cancer, is truly a life or death situation. This access to quality is essential as well, because Black women usually have higher instances of dense breast tissue, which can make it hard to see small tumors in or around the dense tissue. Therefore, Black women need to access Genius 3D mammography. Black women need the option to request the specific tools to ensure they're getting accurate information. That's definitely a problem that we've consistently run into: late diagnoses and inaccurate diagnoses. And when it comes to breast cancer and any of the topics I've covered, really, there's no room for inequality, because that lack of access can potentially result in fatal consequences. So we reached the policy portion, which outlines a few of the policies that advocate for Black women's health and bring us closer to a solution. These important policies are the Build Back Better Act, the Black Maternal Health Omnibus Act of 2021, the Stephanie Tubbs Jones Uterine Fibroids Research and Education Act of 2021, and the Jeanette Acosta Invest in Women's Health Act of 2021. So Martha briefly covered it, but I'll just reiterate the Build Back Better Act. It includes the largest effort to combat climate change in American history. The investment will cut greenhouse gas pollution, reduce consumer energy costs, decrease air and water pollution, create hundreds of high quality jobs, and advance environmental justice by investing in a clean energy economy. Many of these investments would assist disadvantaged communities and communities of color. To address the maternal health crisis in America, congressional leaders have been fighting for critically important policies like 12-month postpartum Medicaid coverage, which would ensure moms have access to the care and support they need and deserve for the full postpartum period. So to build on these efforts, Congresswoman Lauren Underwood, Congresswoman Alma Adams, Senator Cory Booker, and members of the Black Maternal Health Caucus introduced the Black Maternal Health Omnibus Act of 2021. This bill builds on existing legislation to comprehensively address every dimension of the maternal health crisis in America. And here are a few of the bills associated with the Black Maternal Health Omnibus Act of 2021. So the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021 would increase research funding for uterine fibroids, improve awareness and training, and seek to measure costs to government payers. The bill highlights the need for improved patient and provider education surrounding the heightened risk for fibroids faced by women of color. And the Jeanette Acosta Invest in Women's Health Act of 2021 aims to increase women's access to early detection and life-saving cancer screenings, such as clinical breast examinations and cervical cancer screenings. Cervical cancer can be prevented with adequate screening, so it's important that women have the access to do so. So as I mentioned earlier, Black Women's Health Imperative is dedicated to advancing health equity and social justice for Black women and girls through advocacy and education. So here are a few of our most impactful initiatives and campaigns. So when we released our national policy agenda, we launched the Advancing Health Equity campaign to focus on policy reform, advocacy, and to mobilize the community around policy issues that affect Black women and girls. Black Women's Health Imperative and Healthy Women launched the Reclaim Your Wellness campaign to raise awareness of obesity as a national health crisis in a manner that is free of stigma, judgment, and bias. And here are a few examples of the social media posts we use to educate our membership. So we try to, involve stats and quotes. In the US, Black women have a 3 times greater risk and incidence of fibroids and an earlier onset of symptoms as compared to white women. So we created the Unmuting Fibroids campaign to further educate Black women about uterine fibroids and what to look for, what questions to ask healthcare professionals, and more. So here are 2 flyers from the past webinars we've hosted that involved medical experts and legislative staff. And Black Women's Health Imperative launched the Rare Disease Diversity Coalition to address extraordinary challenges faced by rare disease patients of color. So the coalition brings together rare disease experts, health and diversity advocates, and industry leaders to identify and advocate for evidence-based solutions to alleviate the disproportionate burden of rare diseases on communities of color. The Power of Sure, which is on the left, is a breast cancer campaign formed to encourage Black women to get mammograms and educate our audience about breast cancer and treatment options. Mary J. Blige was the face of that campaign. And the Take the Shot for the Win campaign was created to educate and raise awareness of the benefits of immunization as a critical element of reducing hospitalizations and saving lives in communities of color during COVID. So it's basically a COVID-19 vaccine hesitancy campaign. Women of color are diagnosed at a later stage when it comes to cervical cancer as well, and therefore have a higher mortality rate. So the Serving Confidence campaign was created to encourage Black women to get routine pap smears and screenings for HPV and cervical cancer. Sierra was the face of that campaign. And here's another example of social media posts and flyers that we promote on our Instagram. These were created for Advancing Health Equity and Rise for Rare. And I think that was actually the last one. Yes, this slide. These are the social media posts. This slide is a few of our webinars that we've had in the past on voting, obesity, wellness, and sickle cell. We host quite a few of webinars. These are 2 of our climate conversations. We talk to HBCU students and the general public to educate them on environmental justice and climate change. I feel like, okay. And I also wanted to invite everyone to our upcoming maternal health webinar, which is actually this Thursday at 3 p.m. So our panel of experts will be demystifying perinatal mental health and mood disorders, discuss why Black birthing people are falling through the cracks for screening and care, and the path to wellness. So this is an event you definitely don't want to miss. Maternal mental health isn't necessarily discussed as much as it should be. So this will be a really good event. And lastly, I'd just like to leave you all with a really simple call to action that you're all very familiar with, I'm sure, which is voting. So, voter suppression has been widely discussed for years, and the effects on Black and Brown communities have been ignored for far too long. And when people of color are unable to vote, we are affected mentally, financially, physically. It truly hits home. So the health disparities our communities face are largely due to the lack of information, support, and attention that we receive. And voting enables Black and Brown households to demand the resources and support they need and deserve to thrive and survive in this country. So it's important that everyone here today and beyond use their voice for those who can't. There are a variety of reasons that people can't get to the polls, and illegal voter suppression happens in more ways than one, and the lack of those voices puts the bills we have discussed at risk. So, if we ever want to see equity in health, in finance, and education, et cetera, in this country, we have to speak up for what's right. And we firmly believe that change is possible. Hope definitely isn't lost on our end. We just ask that everyone educate themselves, support everything you can that promotes health equity and equity in general, and protect Black women's health. And that is it. Thank you so much.
Thank you so much for the presentation, and to Martha as well. I think I'd like to interject at this point that if you feel the way I do, that there was a lot of things to review, just to know that the link to this program will be on the Clearinghouse website. You can review it in some days when it's posted, because there's so much to learn and understand. So let's see. I see, just one second, let me go to the chat. I saw, here's another. Okay, so we're going to go to the questions that are asked in the chat. We have some more too. Here it is. Karen Humphrey asked, what proportion of pay inequity is driven by occupational segregation, especially in skilled trades? How do we effectively desegregate occupations that are predominantly male or female without having an effect on equalizing wages for all?
You want me to answer? I presume it's my question.
Sure. Please.
Alanna may have something to say about that too.
Of course.
Healthcare profession. It would help, but not as much as we tend to think. Here's why. So-called men's jobs in general pay more than so-called women's jobs. So that's pretty much a given. Construction pays more than childcare, for example, or nursing even. So both are skilled, but construction pays more. So if you got more women in there, yes, you could increase their wages. But the big question is, would their wages be equal to the men's wages in those jobs? Sometimes there are safeguards such as unions or company rules and so forth, not near enough, I might say. So if women are hired into, let's just use construction, are they going to be paid the same as men in construction? So that's a little bit different question than, does it raise women's wages overall? Yes, it does. Obviously, it pays more than their alternative, which might be fast food or childcare. But does it equalize within the profession? That's the second question to ask. I'm sorry to say I don't know the answer. My guess is the pay gaps in the male-dominated professions are smaller, but they're still there. We can see it in the higher levels, surgery, for example. Female surgeons tend to make less than male surgeons. There are, even in some, depending on whether it's a unionized workforce, nursing, male nurses usually do better. So you could say, yes, it does raise wages, which it does, but the relative wages are what we need to look at. And I think it's a very important question to ask and for us to keep our eye on.
Alanna, would you like to weigh in on that as well?
I think she covered it. I also would like you to repeat the question if that's possible. I feel like I was listening to her answer and lost track of the question.
Okay, it's what portion of pay inequity is driven by occupational segregation, especially in skilled trades? How do we effectively desegregate occupations that are predominantly male or female? And last, would that have an effect on equalizing wages for all?
Oh, yes. I think Martha answered that perfectly. I think she knows a little more about that than I do personally. So I think I'll leave it there.
Okay, well, then I can happily go on to asking Connie's question, which is what I would like to discuss. What will the acceptance of the Equal Rights Amendment, ERA, do to enhance the fight for pay equity?
Well, I think the ERA is going to do a lot for a lot. I'll just say that. It's going to say women and men shall be equal in all areas of society. I've just been looking at it, by the way, as what will happen to the abortion issue if we lose, which we may. But the Equal Rights Amendment is going to help, obviously, because it's going to prohibit discrimination in a much stronger way than our statutory laws. It will be part of the Constitution. But the problem is still going to remain the same in terms of enforcement. It says women and men shall be equal in all areas, blah, blah, but it doesn't say how do we achieve this? And that is going to come down to the moral will to do it, actually, which is what we have now in terms of pay disparity. The difference is laws can be overturned. They can be ignored much easier than a constitutional amendment. So I'm not saying it isn't important. It is extremely important. But is it going to make an overnight change? I'm sorry to say, I doubt it.
Well, since you heard a dissident view from my computer, I'll throw in. When I saw Connie's question, I thought, and Martha's answer to anything you put in place can be removed. It's how you enforce it, how you push it. I mean, how you treat it. But I will say, when people say, "Oh, the ERA won't make any difference," I say, if you can diss more than half of the country, majority of people, who can't you diss? Just keep that in mind, okay?
Well, I certainly do agree with that. I have to throw this in. It's a little bit off topic, but it's something we need to be aware of. In the argument over the ERA, which is extremely important right now, and I think we're closer than we've ever been. One guy, he's writing for Politico. He is a respected college professor, has proposed to solve the ERA and the abortion issue within the ERA argument. He said, oh, let's just vote, let the states vote on whether to make abortion legal or not. How you like that? Why don't we vote on whether we have slavery again? Let's just vote state by state. That is how stupid the discussion has gotten. Sorry to get off topic, but it
no, it is. And I just heard a discussion called laboratories of autocracy. If you want to undermine something, you hit it at the state. David Pepper's book, I recommend it. Okay, the next question is from Michelle Hawkins, who says, do Black women have higher rates of children with disabilities due to health disparities? I think so.
Yeah, so Black women actually do have higher rates of children with disabilities. I know that Native Americans come in at around, I think it's like 16 or 17%, and then Black Americans follow with that around 11%. And then white women come after that. So, you know, like I mentioned, you know, basically every health disparity that you can think of, African Americans suffer with them at higher rates. Sometimes it's, you know, because they have a history of the illness in their family, and other times it's because of pure negligence. It's definitely on a case-to-case basis, but I think that's why it's so important for us to have these conversations around health access and access to quality care, because at least if all Black people, all Black women, or all communities of color had access to that quality care, then at least the argument would be, you know, well, we did everything that we could possibly do, and there was no way to avoid this happening. But so yeah, I will answer the first part of the question by just saying that yes, factually, Black women do have higher rates of children with disabilities or issues with their pregnancy, issues with the delivery process. And sometimes, you know, the illnesses or the issues that the mothers or the children face don't last a lifetime. You know, sometimes it's just, you know, when, you know, in infancy or while they're young, but it varies. But yes, I do think that a lot of it is due to health disparities, just because of the insane amount of health disparities that go hand in hand with maternal health in the Black community.
Let me just throw in a comment. Laura didn't ask a question, but thank you for your comprehensive presentation, and also gave some links, which we'll capture too. But Denise asked, her question was, how can we get the COVID-19 She session and multiple inequities women of color face in health beyond the national policy news, beyond Michelle's initiative emphasizing healthy choice, which ignored how obesity is a function more of poverty and stress than choice, and dominant media focus on white women at school board meetings, attacking masks or Toni Morrison books, or promoting singular women successes like Forbes 50 or over 50 and 30 under 30 as just a matter of wit and ambition holding women back. Is that too long for you? I'm sorry, I didn't condense it, and because I couldn't quickly without losing the sense. You're seeing it? Okay.
So I'll just try to address this piece by piece in the best way that I know how. You know, getting articles and information about, you know, inequities women and women of color face in health, international policy news. I think we're already doing, and many organizations are already doing, as much as they possibly can just to bring attention to these issues. I think one of the biggest, you know, challenges that we face is that we have these very big problems, but since they don't affect that many people, I don't want to say people don't care, but they don't necessarily get the time that a lot of other people are educated about or hear about often, or that would affect them directly. It's kind of like an out of sight, out of mind kind of thing. So obviously over time, we've seen that people are actually starting to pay attention to the Black community and realize that, you know, our health is important and that we do deserve to live. So I think slowly but surely, a lot of these inequities will be talked about, you know, on broader scales. But I know that my organization, many of the organizations that we work with, we get the chance to publish, you know, multiple op-eds on certain, you know, health disparity topics. And we get to speak at congressional briefings, and, you know, we help host events on the Hill, and sometimes those get on the news. So I think it just takes like a little bit of advocacy and education and mobilizing in like every which way to get those pieces up, and then people kind of just see bits and pieces as they see them. But I think just the more people advocate for a certain issue, then the more attention that will be drawn to it. I mean, I think the perfect example is like George Floyd, there were many Black men that were killed by cops before that happened in 2020. But since we were all in the house and it was on camera and it was 9 minutes long, and then, you see one city, rallying together, then other cities decided to rally together. So I think it's just, a mix of word of mouth and educating yourself and realizing like, oh my gosh, this is a problem. These people care about it. I should care about it. And it kind of snowballs from there. But as far as it a matter of wit or ambition, yeah, I don't know. I just think that health disparity, I think just, the disparities that we face in health, I think it's just also, I think it's just an issue of getting people to realize that it's an issue and recognize it as an issue, and then give us like the space and time and respect that we deserve to I guess, share that information on a bigger platform. And that takes time. And Michelle Obama, I mean, like all of these are pretty big names. So it's easy for them to use their platforms to get the information out. But everyone hasn't heard of Black Women's Health Imperative, or, it's just any of the, people have heard like of NAACP, but I think just the bigger the name, the bigger the platform. So it's just important to get to those folks with bigger platforms that can reach more people, and then the information will get out. But I hope that answers the question. I'm not a marketing expert.
Yeah, well, here's a related question that your presentation focused on reproductive health justice more than just the abortion issue. But Karen's question, Karen's question was, how do we leverage the battle over Roe v. Wade to create a more comprehensive policy effort that moves us toward health equity? Alanna, do you want to take that again?
Yes, I'm thinking about how to answer it. We leverage the battle over Roe v. Wade to create. I mean, I feel like, the issue of abortion is such a touchy subject across the nation, no matter what side you're on. And obviously, Black Women's Health Imperative is extremely supportive of women's right to choose and people being able to do whatever they need to do for their well-being. It's really no one else's business. I think all I can say is, advocacy, voting, and kind of collaborating with as many other organizations and people as possible to get the information that needs to be, shared, I guess, spread. And, I mean, that's just such a hard, there's no one answer for that question.
Right, but there is some marketing perspective in that question. I mean, in that strategy, no question about it. I'll move on to Connie's question. Is we're currently experiences really high rates of inflation, and what is the effect of the high rates of inflation having on both wealth and health for women? Both of you.
I'll take this.
Thank you. Thanks.
Well, obviously, if you are not in a system, I think Alanna would agree with this one. If you're not in a system such as Medicare, Medicaid, or private insurance that pays for your health, you're in trouble already because the cost of out-of-pocket costs are going to go up for everything, including Medicare. It's just a matter of time. But I think in terms of inflation, we used to have an expression called the wage price spiral, which means prices go up, wages go up, and then prices go up because the corporations say, well, we can't make a profit. And so we have to raise prices because we had to give these people $11 an hour instead of $9 an hour. And it is such a false comparison. My husband is in the field of corporate accountability, and he often says, and I think we all need to remember this, he says, you often hear, oh, well, business has a right to make a profit. And that isn't true. Business has a right to try to make a profit. Yeah, they'd make a lot more profit if we went back to slavery, wouldn't they? So we have to start talking about curbing the rights of the very rich, the stockholders, the people that are at the top of the heap at the expense of the bottom. And so inflation is bad, for, much worse for women and men at the lower end of the game. But nobody ever talks about, well, gee, could we cut that dividend by a penny? So let's just put that in our thinking cap, as my third grade teacher used to say.
Yeah. Alanna, would you like to add to that? You don't have to.
No, I think she covered it.
Okay, let me ask you a couple questions additionally, that, and if we come up with more from participants, they'll get the priority. But we can measure wealth quite easily by bank statements, by different measures that are available to. Can we measure health? Or maybe the question is, how can we measure health outcomes? That we made improvements.
Well, I mean, I think it just, in simple terms, if you're measuring health, I think it's like how good does a person feel mentally, physically, spiritually. Health isn't, just a one-track subject. It's just around overall well-being. And when you think about, even if someone is healthy, if their health is at risk, or if something were to happen to them and it would be harder for them to get health, then they're not necessarily in a healthy situation or a healthy environment. So I think like optimal health would be that if you are physically healthy, that you feel mentally sound, and you are at peace with the fact that you are covered if anything were to happen. And I think you start going down, the unhealthy road if you already have a pre-existing condition. And if you don't, then you don't really have coverage if one were to come up, because then you really don't know how to handle that. And then the stress of that obviously would contribute to whatever you're going through and make the situation worse. It just kind of snowballs when you are, I guess if you don't have access to the care that you need. So I think health has to do with like the physical, and then also the access that you have to help if you were to run into a health issue.
May I add a footnote?
Of course.
If we had universal health care, it'd go a long way towards solving the problem. Many people in this country just flatly do not have access to quality health care or any health care at all, because it is a financial barrier. We are one of the few countries on earth without some kind of industrialized countries, I should say, without some kind of universal health care that is subsidized by the government, instead of being made into an engine of profit for healthcare organizations, pharmaceutical companies, you name it. So we need to think about the bigger picture. How do we change the structure? And the structure, one way would be universal health care. And the argument right now over Medicare paying for drugs and the drug prices and so forth, Alzheimer's drug, I think, is what's at the forefront. That is a perfect example of why we're in the mess we're in healthcare in this country, because we have to balance off profits against healthcare corporations versus the well-being of our citizens.
Okay, here's a related question. Even though healthcare is so fundamentally important to our lives, can you think of any other aspect of our lives where we don't go for a second opinion? Would a second opinion change things in terms of, I mean, because we're talking about people here who are not, a first opinion is not available to them. But isn't it interesting? I mean, it was just a random thought I had, that for every other walk of life, we say, okay, what do you think? What is the price of this? What is the result of this? We don't in healthcare. Is that too confounding? Is that too off the wall?
So I'm sorry. So can you just repeat the first part of the question?
Well, it's just that we don't go for a second opinion on
Other things.
healthcare. And we just accept what a first person who we speak to, and maybe it's the confidence of our own personal doctor, but maybe that personal doctor isn't experienced in the health crisis that I'm having, right?
So I'm not sure why we do that. That's something actually that we try to push with the Rare Disease Diversity Coalition, because many people of all races that are faced with rare disease, since there isn't, there aren't as many resources and there isn't really much research backing, maybe the symptoms that someone is facing. So they'll go into the doctor and they'll, tell the doctor what's wrong with them. And usually, regardless of who they are, the doctor will be like, you're fine. Like, this is probably this or this. And so getting that second, third, fourth, fifth opinion is really important, especially when when it comes to people of color. I spoke about, being ignored or people kind of being negligent when it comes to complaining about concerns around health. And so getting that second, third, fourth opinion, is really important. You know how you feel on a daily basis. If you know something is wrong, then it is up to you to advocate for yourself and go find answers. And so there are many people who have been through a lot. And for the folks who have been to 4, 5, 6 doctors to help diagnose the really rare epilepsy in their child, many people, as you said, cannot afford that. But I think that if anyone has health access, they should seek a second, third, fourth opinion if they feel that they need to. I'm not sure. And a lot of people do it just because, we're told to trust doctors. We're told to trust authority. So I think it's easier to just say, oh, you went to school for this. I'm just the patient. You say I'm fine, so it's fine. But when something is wrong. So I feel like if you're perfectly healthy and, it doesn't make sense to go to 10 different doctors, but I definitely think that is something we should utilize, especially for those who have access to that option.
I have one more question, if no one else has a question. I think it was yesterday's post cited the fact that far fewer people are applying to colleges. Do you think that has an impact on either or both health and wealth in our country?
Well, I'll start with the wealth thing. It absolutely does. College, as we know, increases your lifetime earnings exponentially because more of the higher paying jobs are college level or above in the requirements. It's not universally true. Some of the trades, again, thanks to the unions, are pretty highly paid. But there's a definite correlation between access to higher education and lifetime earnings, without question, women and men.
Alanna?
Yeah, I definitely agree with Martha. Also, many people of color are, a first year, they're the first to go to college in their families. So if you really haven't seen anyone in your community or in your, close family that has gone on to pursue a degree, you may not feel like it is absolutely necessary. You kind of go for a trade or, find a lower paying job. People usually don't fall far from the tree. So I do think that it has to do with that. I definitely think it has to do with, finances. College is extremely expensive, even for people who make an okay amount of money. So I definitely think there's a financial piece of it. And this is also kind of unrelated, but I do think that, Gen Z and the younger generations now, they're very into, entrepreneurship. So I think that, you know, strangely enough, even though, you know, college is still very popular and always will be, I think people are, you know, just starting to find new ways to make money and get creative. And with tech growing so quickly, I think it's easy for people to kind of pick those different avenues. But for folks who do want to go to college and don't get to, it usually is a financial issue.
Thank you very much for pointing that out. I will give, just by way of example, I have a grandchild that is starting college in the fall at a state university, $30,000 a year. And that is a state university. I hesitate to even think what a private would cost. It's a barrier, and it goes without saying, to people of color more so than white people, but it's a barrier to everybody. That's a lot of money.
Well, I will point out Karen Humphrey's comment on the chat. Last one is the National Women's Political Caucus of California is planning a symposium on reproductive health and justice, looking at current court cases, but also exploring related issues like maternal health outcomes, access to contraception, quality prenatal and postnatal care. And you can read it, it goes on. But the other part, this symposium will be held on Saturday, March 26th. You can find it on their link. But she thanks both of you, as we all do, for this program. And we hope, she said, I hope we will share in our own organizations and arenas. I think we both all do. And thank you for that comment. And thank you so much for your presentation, for bringing all these things to light. I'm sure no one can leave without having learned a lot. And so thank you. I wanted to just, in addition to closing with many, many thanks, I wanted to just tell you that next month's CWI meeting will follow up on this with on Black health. And
Dr. C. Nicole Mason from the Institute for Women's Policy Research, IWPR, and Dr. Ethlyn McQueen Gibson, Director of the Center for Gerontology and Excellence at Hampton University, and possibly an additional speaker. So the theme will have some follow-up and focus on Black health and wellness, which is this year's Black History Month theme.
thank you, Sherry. And that enables me to thank you for all that you did. Sherry did a lot on this program. And we all thank you and hope to see you again. Join CWI if you haven't. And but join us again. Take care. Many thanks. Bye-bye.
Bye-bye. Thank you.
Bye-bye.
Thank you.
Thank you.